Hearing none, I'll go ahead and accept those as they are. Thank you for that. Moving on to item 3, alternative revenue and sustainability strategies. This is a big one for us. So we have Peter Barth, Rena John, and Kim Patillo Bronson will be presenting to us about how we're going to keep this place going.
Support children.
Yes. And while the PowerPoint comes up, in our last board meeting, when we talked about policy and advocacy, when we heard from our executive director of our association, Moira Kenny, a lot of these issues came up and to the forefront. And as our executive director said, we would spend a lot of time talking about this with you all. So this will be hopefully just a robust discussion where you can hear a lot about what we're working on and what we're doing across the organization, not just in any one of the departments that you're hearing from today, but also so we can hear from you about where you have thoughts and priorities and other things for us to know and keep in mind. So I will just open it up, provide a little bit of context, kind of ground us in some of the conversation, and also share some examples. While we have more recent focus on some of these issues, it's not new for us to be talking about this, and we want to point out what it's looked like in the past. We're going to do a deep dive with our family support team, who are surrounding me right now, about our largest investment in home visiting and what sustainability means for our work, not just in home visiting, but also broadly across all of our programmatic work. And then finally, Kim Patillo Bronson will guide us through some conversations around alternative revenues and some of the near-term opportunities we have and what you can expect staff to be doing a lot more of in the future. So with that in mind, I'm sharing this quote, which should not be new to any of us, courtesy of our executive director. First 5 LA is not the agent of scale or sustainability. What is?
And I have to give proper due to, I believe it was Dr. Neil Kaufman, who first gave voice to this incredibly important foundational point message.
Wonderful.
Go Neil.
Thank you. But what does this really mean? I think our executive director at the association, Moira, shares how right now we have about $125 per kid through First 5 funding. But even at our high point, that number was more like $200 a kid. And is $200 a kid really the way that we're going to be able to support quality early learning and home visiting programs to make sure that families have access to the critical health services they need? No. First Fives are not the agent of scale or sustainability. We have partner systems who are, though. We have LAUSD as just one of many school districts spending nearly $8 billion a year on services. We have our state of California with the largest general fund budget in history of over $180 billion going to services and supports. And so First 5 may not be the agent of scale or sustainability, but we are partners. We're innovators, we're collaborators, we're supporters and influencers. And that's why our new strategic plan highlighted these exact focused investment strategies as how we should be spending our money and how we should be showing up with these systems to help make sure that those revenues are going to support the services and supports our families need. Just a little more context. Big surprise, our revenue is declining. We heard from our finance team yesterday or last month about what that meant in terms of our future. But it's really important. One of our former commissioners, Dwayne Dennis, said our new strategic vision and focus isn't reliant on the fact that we have a declining revenue source. This is the right thing. We should be doing it no matter what. And if you actually look at the text of Proposition 10, if you look at the enabling statute, it doesn't say that First Fives should be the systems funding these services. It actually says, and these are exact words, that First Fives should be facilitating the creation and implementation of an integrated, comprehensive, and collaborative system. And I think that's really important for us to keep in mind, that in some ways, First Fives and First 5 LA are kind of returning to what the voters initially intended when they created and approved Proposition 10. And finally, it gives us an opportunity to think about how we can increase our focus on outcomes for all children. I think it's important that we have this conversation grounded in some common definitions. So when you hear us say sustainability, what we're really talking about is maintaining investment in critical services and supports for families and young children That means that as we look at all the different things that either we have funded or that our partners have funded, we need to be looking for opportunities to scale and sustain those programs through multiple different means. But when we're talking about alternative revenues, we're talking about growing the pie. We're talking about how do we make sure there's more money that's available for early childhood. And so they're distinct, but they are obviously related. And finally, like I opened with, we do have some examples of success, and we have many, but here are just a few. And I'll walk you through them briefly. So first is oral health. I think as many of you know, we have historically funded oral health programs through what was known as the Children's Dental Care Program, CDCP. It was a 5-year investment critically in two things. One, working with strategic partners at USC, UCLA, and Western to both build infrastructure, create infrastructure to be able to provide more services to young children. So that meant everything from mobile clinics to technology infrastructure for virtual services to the actual brick and mortar clinics themselves. But it also was paying for those providers to be able to provide services in those clinics, and we were able to serve close to 100,000 children through those programs. But again, we weren't going to be able to continue to support 100,000 kids, and we weren't going to be able to support 600,000 kids. And so what our policy team did in partnership with the program team and in partnership with other local First Fives who had significant investments in oral health and in with our association was help to elevate the importance of improving Denti-Cal, the oral health services program for Medicaid, and to make sure that the state, as it was applying for its waiver from the federal government, actually prioritized oral health services for young children. And as a result, also make sure that there were new revenues that were supporting the Dental Transformation Initiative, DTI. And DTI basically was something that was incorporated into the waiver process that envisioned a competitive grant program for counties to be able to provide and expand services through Denti-Cal to more families and young children. And because of the direct investments we made on the ground, LA County was successful in receiving that funding. And so all of our grantee partners are able to continue to provide services using the infrastructure we helped pay for. Another example is in our family strengthening work. Many of you are familiar with the Partnerships for Families program. It's a program that is now currently operated by the County Department of Children and Family Services. And it's a program that's had a successful track record in reducing re-referrals to the child welfare system. This is a really innovative program because of how First 5 LA went about investing in it. Rather than doing what lots of funders, not just First 5 LA, have often done, which is go fund a little pilot project on the side, do it on our own, and then when it's over say, great, who likes this? Who wants to help pay for this? We worked up front with the Department of Children and Family Services. And when I say we, yes, I include, I don't include myself because I wasn't here for this. I can't take any credit. All credit due to people like Barbara next to me and to Bill Gould for their work on this. But that's an approach that we want to use more of. Work with those systems leaders at the very beginning before we spend any money to make sure that the programs we're piloting and testing are ones that our county partners actually need and want. And fortunately, we were also able to pay for evaluation to prove that this program had an effect. And so that's why the Department of Children and Family Services is now continuing to pay for and support that program even, excuse me, even after our First 5 investment has ended. And then finally, in the bucket of alternative revenues. Day one on the job for me, I learned through our state advocate that there was a growing movement from a number of health advocates to increase tobacco taxes so that they could pay for more services, which was great because we wanted some of those services to pay for things like oral health services, which it's doing. But we were also a little bit concerned because anytime you change taxation schemes on tobacco, it changes how programs that are already funded by tobacco, like First Fives, how they maybe get funded. And so we were able to, and to make a very long and complicated story that also involved Christina Altmeyer in her former role as the head of the Orange County Commission, we were able to make sure that not only did First Fives get protection and backfill through the new tobacco taxes, but that the new e-cigarette taxes that were a component directed new revenues to First Fives, and that was not part of the initial plan or vision of some of those health advocates. I will say that what this effort highlighted for me was how little people cared about First Fives um, outside of the First Five world. And so it was a real moment to say, we need to do more of this. We need to be highlighting the First Five work more. We need to build champions and partners more so that more people think of First Five as an important and critical partner in moving advocacy and not a group or an issue that can be forgotten. So with that, before we move on into the examples of home visiting, I've just said a lot of things, and I think it would be great for us to hear from you. Any questions, thoughts, reactions, or comments you may have?
Commissioners, do you have any questions? Commissioner Smith?
I just have a question about your last comment, which was really very interesting. And it makes me wonder what you feel we can do and should be doing to change that reality.
And I think Kim will hit on this a little bit in the section on alternative revenues, but I'll just highlight that part of it is just building relationships. First Five here locally is doing a much better job of working with all of partners, whether it's healthcare systems or clinics or county agencies. But at the state level, there are a lot of very powerful and influential voices that represent doctors and represent health plans who have strongly influenced the decisions made in the legislature, made by the governor, and they didn't necessarily know who we were. For people who did know who we were, they thought sometimes, oh, well, First Fives, you don't care about child welfare, you don't care about health plans, you care about the things you fund on the side. And so we've spent a lot of time over the last couple of years just trying to build relationships, build understanding, and say, we do really care about child welfare, we do really care about health systems, and we want to be partners with you. And so I think a lot of it has been and will continue to be education and partnership building. And doing work with others.
You might want to connect the dots to the board presentation that Moira Kinney provided earlier in the month, the network strategy being actually very much in reaction to some of this learning that you
Absolutely. One of the key takeaways from the network strategy that we've been big partners on with the association is this idea that First Fives need to be more than just a collection of individual organizations doing great work locally, that we need to then band together to be an organization and a network of voices on behalf of not just First Fives as organizations, but the first 5 years and children and families statewide. And quite frankly, a lot of organizations do that well. There are a lot of very strong associations that represent the interests of whether it's everything from Behavioral Health Directors Association, Hospitals Association, and so what we're trying to do as part of that network is be able to elevate the voice of First Fives, not just one individual First Five over the other.
Commissioner Taylor?
We need to also bring it down to the community level and then educate the community about our efforts so they will be aware of what we're doing, hold conferences or seminars or discussion groups about what we're doing. That's very important and powerful if we're looking for support on what we want to do in the future. I was very appreciative of the strategy dynamics that you provided at the last meeting that we can carry around and give to other people. So we need more of that kind of messaging that is easily discernible to communities, families, and somehow we have to, as leaders, because I see what this organization has been doing is great dynamic. We need to pull the state in a conference either once a year, once every other year, or however you think, so that they see us as thinkers and movers around these concepts that we're trying to move forward for all children and families in this county as well as the state. That way, we will bring in these different thinkers of health, mental health, DCFS, and then have a forum around that and get our partners to be doing sessions and presenting and highlighting what we're doing with them. And then that gets to be a more real thing. And we can invite people from the feds and others into this dynamic and conference so that they understand that we're actually on the ground really doing it, and eventually we're going to be if we're not already in the Washington, D.C. talking about these concepts so that we can then broaden our horizons. Just a thought.
I was just gonna, there's maybe two things that I think we're talking about at the same time. One is about people understanding what the role of First Fives are and what the role of First Five is here in LA. And then there's another which is about issue understanding about the importance of 0 to 5 and what societal responsibility we all bear for that. There's a lot of overlap in those conversations, but they require different strategies to develop sort of good offensive work on those. A lot of the relationship building work that Peter was describing earlier, I think is doing both, is serving both objectives of trying to both elevate the role that we can play in Sacramento as well as here in Los Angeles, while also making the case to some organizations and players who have not necessarily thought of 0 to 5 as a public responsibility in the past. We'll be at a commission or PPC meeting near you. We will be sharing more on what we're learning in focus groups from parents about what they understand of their own responsibilities and how they think of the public's responsibilities and supporting them as well. But I think what's sort of an interesting almost paradigm shift moment is to think about some of the other big sort of public health campaigns. We were talking earlier this week actually about seatbelts as a public health campaign that has really shifted in my own lifetime, where I certainly grew up not thinking about seatbelts until there came a point where everyone was thinking about seatbelts. And some of the partnerly aspects of those works meant that there was a public messaging campaign of everyone viewing it as parents' responsibilities, as kids' responsibilities, but also the car manufacturers' responsibilities and government's responsibility to require that there be seatbelts in every car, that the CHP tickets, and thinking about how to deploy each of those different sectors of civil society to engage in problem solving together is a little bit of this issue of how do we make it so that there's a value proposition in our sustainability work so that people want to sustain what we're saying needs to be prioritized.
I'll also add, and I really appreciate the call out on community. So I think a lot of our journey over the last couple of years has been around focus. How can we make sure that we're focusing our efforts so that we can achieve maximum impact? But as our executive director said in the first board meeting, one of the goals of 2018 really is integration. And like I said in my opening comments, this work, although we're right now sort of the vocal representatives of it in this meeting, one of the key takeaways is really you should be hearing themes of sustainability and alternative revenues and partnership in every presentation you hear, no matter what division it's coming from. In our work, and we should be elevating more the connection points. So one thing that you'll hear a little bit later in our alternative revenue section is how it's not just the policy department that's talking about it, but our community relations department as led by Rafael Gonzalez and the connection points between these efforts. So again, it's a newer frontier for First Fives, but it's the direction we need to be moving in, and we need to be doing more of it, and I really appreciate that call out.
Commissioner Tilton?
It's important to remember that families that have children, pregnancy to 5, have older children as well. And so if we're going to help a family with a very young child, we're going to need to do something for the children over 5. I'm remembering partnerships with families, which we work very hard on addressing children's risk and realizing that children who were referred into DCFS who were at greatest risk were under 5, actually under 3, under 2, but we couldn't really develop a program just for part of the family. So the partnerships really came out of two things. One was we had money to invest in it with a commitment, if whenever possible, DCFS would come in with a Title 4E waiver. that would enable them to pick up the cost. So it took a little longer for them than we thought, but it was based on our ability to invest in this and then turn that over to the county department, and that county department utilizing other departments to provide the services, so these families who didn't need to stay in the system could be served in the community. And that did do something very, very important, and that was provide outcome and results that were provable if these families didn't re-enter the system as often. So that's just a thought that I have. The two thoughts were, well, one, we had the money to invest. Secondly, that we have to think about families as inclusive of the children when we provide services. And third, that sometimes we have to hope that there is an agency that will have the ability to pick up on this service and then engage other agencies as well. And then once you have that outcome, you're golden. And child abuse rates have gone down. Hardships has made a big impact, and we should be very proud of that and keep reminding people of that. And I know I'm not sure that I do that enough, or the commission does that enough, to say, hey, we have presented on the kids with this particular effort that was unique at the time, hard come by in terms of figure out how to transfer, how to invest the money, how to get it transferred over to an agency, how to have confidence that that agency is able to pick up on it, and assure the quality of the service. That's just my 2 cents.
Sorry, I'm thinking university here. Commissioner Abdo.
I want to tell a story that I heard yesterday at the Early Childhood Task Force in Santa Monica. And I don't know all the details. I've asked for more, but it goes right into this integration and facilitation among county agencies. There was a family living in a van that was discovered by somebody who was just working within the park system and family services in Santa Monica. And it turns out the family was a woman with 6 children living in a van. And the reason that they were in this situation was domestic violence, but I don't know any details about that. The woman is working in Santa Monica, and the children are going to school in Santa Monica. Age range is from, I believe it started when they were first found at perhaps 6 months, maybe a little bit younger, and then kind of stair-stepping up. And so she needed many systems to help her, and she was directed to do this and that, to go here and there, and she filled out all the forms and talked to all the people, every single thing that you would expect somebody to do if they were really plugged into how the system works. 3 months later, she was still homeless, living in a van because there weren't enough vouchers, especially for a family of 6 children. And finally, eventually, she did get a voucher for a motel that is an hour and a half away from her job. And so every day she's spending 3 hours driving with the children, and she's nursing the now 9-month-old child. So she has to pull over and nurse and then get back. You know, I don't know where the 1.5 hours drive is, but somehow we're failing this family, even though she's done everything that she's been advised to do, and everybody in the helping world has been trying to help her. There aren't places on the west side for a family with 6 children. I'm not sure there are any places at all for vouchers that take vouchers. But somehow in our work as people who are concerned about 0 to 5, we need to look at this. And the homelessness issues that are happening, they're talking about it today, I believe, in the state, about more funding, an enormous amount of more funding. And of course, we're talking about it at the county level and the city levels too. But in the meantime, here's a family that needs help. And there's, you hit a brick wall when you're trying to help a family that has this kind of a need. And she's working. So I just wanted to bring that in. I'm going to get some more details about this story, because the interesting thing is that this woman is not hiding, and she's willing to go to meetings and tell her story, which is very unusual, I think. And I haven't met her or heard her tell her own story, but I found that fascinating too. I don't know all the different departments that she's interacted with. I don't know. She's been, I think, working with many departments of the county.
Thank you, Judy. We'll certainly think about that. Other comments by commissioners? Questions?
My only just going to Judy's
Sure.
comment, if I may. And I appreciate it was a story shared with you, which you're sharing with us, but regrettably it's probably repeated countless times on a day-to-day basis. One of the things we're going to talk with the board about in March is about our work with county agencies, and specifically some of the systems-related work that John and OCP are co-leading, which is really about how can we together work to create more family-centered and family-friendly systems that reflect family needs and circumstances, not just the needs and circumstances of the funding streams and the programs. And Lord knows it's easier said than done. We are not the first group of individuals who said something must be done. But the good news is both agency leaders as well as leading funders are coming together along with community. Because again, it's interesting, when you hear from the Best Start families, generally they're not saying we need more services. They're like, help us navigate what exists. So that we'll have an opportunity. We're going to go deep. We're going to do some breakouts. So I don't want you to feel and others feel like, oh, well, man, there's a 500-pound gorilla that just got put into this room. We're not going to profess to solve it next month, but we're going to have an opportunity to engage more.
Thank you. I would just like to underscore what Commissioner Taylor said, and I think it's tangentially related to what Judy just mentioned, and that is how we're being perceived by people on the ground. Because as many of you know, when this commission first started, it had a very different kind of flavor to it. And we're redirecting the ship now to a more systems focused, which means that we're further away from direct services. And so therefore, how are people perceiving what it is that we do becomes extremely important as we move forward. And so this communication, and I think Maura brought it up at the commission meeting, that is huge, not only for individual commissions, but as a network as we move forward. And so I would want to think that we are really thinking very clearly about that as we go forward.
Absolutely. Thank you for all your comments. Again, we're just going to now pivot into another phase of this discussion, which is providing a deeper dive into one of our largest investments in home visiting. And so I'll hand it over to Rena John, our Senior Program Officer in the Family Supports Department. But I think, and I just want to underscore this piece as well, I think sometimes the messaging has always been, great, so First Five is not going to do direct services anymore. We're only doing policy and systems change. And I think what this discussion will highlight is that's actually not true. It's just direct services to what end? How are we going to fund services to inform systems, to work with systems, to improve them? And this is a really good example of where the sustainability frame and our long-term commitment to home visiting is changing that. So I'll hand it over to Rena now.
Thank you, Keith. And good afternoon, commissioners. We're going to start this sort of deep dive into home visiting sustainability with this visual that I know you've seen before. It's basically a house, which is representative of our home visiting investment. The door correlates to sort of direct services and how families enter the system, but also how families experience those direct services. We've also got a learning agenda that sort of broadly correlates to our evaluation-related efforts, as well as our policy and advocacy efforts, which very much links to sustainability. And finally, system building, which is an area I think we'll spend a lot of time on today. And really, it's about partnerships with county agencies to build a universal home visiting system for LA County. So I'm not going to go, before I go further, I really want to call out that this house is standing because of the work and the effort of a lot of our team members on our home visiting team. So I just want to acknowledge Diana Cariaga, Claudia Molina, Marlene Cole, Maria Aquino, Elaine Poliski, Melinda Lady, and Carlo Herrera. So, and of course, Barb, our fearless leader and director over here.
Fearless.
Of course.
So, some context to start with. One, home visiting is First 5 LA's most significant and long-standing direct services investment. Right now, home visiting represents 35% of our overall programmatic budget. Home visiting, First 5 LA is also currently the largest funder of home visiting in the county. So of all the home visiting funding in the county, our efforts represent 45%. And then finally, we just want to call out, this is a very historic and sort of opportune time for home visiting in the county with the passing of the 2016 Board of Supervisors motion on home visiting that was supported by Supervisors Puel and Hahn. And we'll talk about each of these in a little bit more detail. So this diagram just kind of reiterates how significant home visiting funding is to our overall programmatic investments. So you'll see our budget is $118 million, and of that, home visiting is $41 million, so about 35%. So as mentioned in the December of 2016, the LA County Board of Supervisors directed the Department of Public Health, along with First 5 LA, the LA County Home Visiting Consortium, and pretty much every child and family surveying county agency to sort of come together and develop a plan to coordinate, expand, and advocate for high-quality home visiting programs. This was a major milestone for LA County Home Visiting in that it put partnership and working together really at the center of this effort. This group, led by DPH, has been meeting literally every 2 weeks since the start of 2017 to develop several reports and updates that you see there that have gone to the Board of Supervisors last year, as well as some reports that are planned for this year. So the county motion, and as well as First 5 LA's current strategic plan, have really elevated our home visiting sustainability efforts. We've identified a number of goals. The first two on this slide really relate to what we sort of broadly want for the home visiting system. So first, you know, we always want to keep our North Star in terms of, you know, our main goal being really strengthening policy and systems to ensure sustainability of positive outcomes for families. Secondly, I know this theme has been reiterated many times, but this idea that we really figure out how to maximize all existing sources of funding for home visiting, whether it's federal, state, or local funds, and also, you know, in tandem, also look at new and emerging types of funding. The last two bullets are really about the goals that we have for our grantees. who play, our grantees and really all home visiting providers who play a really critical part of this system. So when we talk about what our goals are, we really want to look at strategies that have sort of broad application for agencies. In a moment, we'll talk about targeted case management, a strategy we're piloting with 20 of our home visiting grantees. TCM is a strategy that is a category, sort of benefit category of Medicaid. And while we're using it in the context of home visiting, it applies sort of broadly to health and social services. So in a sense, as we test this strategy and we build this capacity amongst our grantees, we really see it as a capacity building opportunity more broadly for these agencies. And finally, we know that engaging in sustainability and fund leveraging work is going to really mean that our grantees and providers work in different ways. There will likely be a learning curve, and we want to make sure that we do everything we can to provide the appropriate training and technical assistance to support that. So this slide also we've shared with the Commission several times before, but this is the overall funding landscape in LA County for home visiting. These are FY16-17 numbers. In total, there's about $92 million that came into the county for home visiting that year. You'll see in tiny font, hopefully you can read that, but on the right-hand side, blue, that's First 5 LA funding, 45% of the overall pie. And then other sort of major contributors include the Early Head Start dollars, Department of Children and Family Services, Department of Public Health, Mental Health, and a small portion of private funding as well. So this diagram is a breakdown of our home visiting investments. So it's that $41 million that we pulled over to this slide, and we're breaking it out by type of investment. You'll see our Welcome Baby and Universal Home Visiting efforts are 50% of our total investment. Select Home Visiting is another 33%. And then we've got infrastructure, which includes like our oversight entity for Welcome Baby, various pilot efforts that are underway that we'll talk about in a bit, as well. Those comprise about 11%, and then we've got evaluation at 6%. So as you look at this visual, if you can just hold on to the direct services, those are the blue and the red, those are 83% of our total investment. So as you think about that large portion of First 5 LA funding for direct services, here are some examples of some really exciting emerging opportunities for sustainability. For sustainability of portions of our investment, but also for system expansion across the county, because we know the gap is huge and the need is high. So as you look at these, you've got the first three strategies there are strategies that are underway currently. We've got targeted case management. We mentioned that. This is the most widely used type of funding for home visiting in the nation. And importantly, a recent policy change at the county level created a space for non-county entities to now participate in TCM, which means this really opened the door for First 5 LA grantees to now utilize that platform and draw federal dollars down. So this is really exciting. We have a pilot underway that was launched on February 1st. It'll be running for a couple months, and we should have some findings to share with you by the summer. The second strategy there is temporary assistance for needy families, and that funding is typically administered by the Department of Public Social Services. It's a type of funding that is used in 26 states for home visiting. So it's just not the case here in LA County. But we have a really exciting pilot underway there as well. And that is in November of 2017, First 5 LA partnered with the Office of Child Protection, our local Department of Public Social Services, and Shields for Families, which is a one of our home visiting grantees to make 50 home visiting slots available for DPSS clients. So that's another really exciting development underway, as well as on a policy level, it's important to note also that the governor's budget this year included $26.7 million in TANF funds for home visiting. So this could be, as we see this sort of pilot effort underway happening on the ground, we think it really positions LA County positions us in a strong way to possibly draw down those funds if they become available. So that third funding opportunity listed there is the Mental Health Services Act Prevention and Early Intervention dollars. This is a really significant investment by the local Department of Mental Health, which has redirected PEI, or Prevention and Early Intervention dollars, late last year, a total of $50 million, $25 million per year, to support service expansion for home visiting. So that's really exciting, and in the next steps, we'll talk about a staff request we have around providing some TA support for that funding. So I think the last sort of area, we wanted to highlight some other potential sources. We know that a lot of other states and localities are using these funding sources to support home visiting, some of which are currently used in LA as well, but we want to continue to explore those opportunities. And finally, I think the final note on this slide is that our partnership with the county, the board motion, really helped, I think, elevate a lot of these partnerships and a lot of this great work that's happening and underway. So this next slide is taking those last two investment areas, evaluation and infrastructure. Currently, First 5 LA is the funder of these efforts, largely with some private philanthropic funding. But as we saw from the county landscape, private philanthropy represents a really small portion of the pie, less than 1%. But private foundation funding has really been proven to be incredibly significant when we think about funding more sort of catalytic and pilot activities and coalition work. So they could play a really important role. And we just wanted to lay out that our First 5 LA Strategic Partnerships Department, along with the County Center for Strategic Public-Private Partnerships, as well as the LA Partnership for Early Childhood Investment, have been very instrumental in sort of moving these conversations forward with philanthropy. So I think actually we're going to take a pause there because we shared a lot of information, and see if there are questions.
Commissioner Woods.
Just
a
simple question. Thank you for the information. It's very enlightening for me because I hadn't gone this deep with your home, with the First 5's program. Have we looked at the potential resources or areas that we think we can tap into, and how they may be impacted by the proposed federal budget that's coming up? Because there's quite a few programs, discretionary programs, that are being looked at for reduction or even elimination.
Well, the most exciting piece that just happened with the budget was the reauthorization of the federal McREE program, which is the maternal infant early childhood home visiting. Is an acronym. So that was a big focus of it with our national partners and advocacy to ensure that that program was funded. So it was funded at the current level for $400 million and nationally. Yes, nationally. I wish that was an LA County number. But that will continue. Primarily that funding in California goes to 3 counties, of which LA County is one. And that funding supports public health nursing through the Department of Public Health, primarily to administer one very intensive program for the highest risk moms, known as Nurse Family Partnership.
Your questions, Commissioner Smith?
Thank you. I don't know if this is, it is a question. within the gap that exists, which I'm not sure you said what you estimate that to be between need and what's currently available, but within that group, I think we would all agree that teen, expectant, and early parents are a high-risk group, and within that group, kids in foster care who are either pregnant or parenting during the first couple of years are probably the most vulnerable and have the most potential to prevent intergenerational, neglect, abuse, etc. So I guess what I'm wondering is whether some of the current pilots or initiatives focus at all on either of those smaller circles of vulnerability.
I would
Yeah.
say, I want to talk about
I was going to speak to the gap versus need piece, and then maybe you can take that. I think one of the things that we've been doing as a board motion work group has really been thinking about that question and doing almost like an inventory of what are the services available here in the county currently across all of those different programs that we mentioned earlier, and then also looking at the need and what is the sort of the difference between those. And in terms of need, we have done some work looking at like the 130,000 births and kind of looking at tiers, maybe who's in the high risk versus a medium risk versus low risk, and figuring out how we can allocate our services, our available services, and from there what the gap is, if that makes sense. So I think that's more to come, but we're definitely looking at that, and I think that as we roll out that report in June, that'll be a piece we'll want to share, and then the financing of the gap is really important as well. So.
Yeah, we have risk assessments within the system, particularly within our Welcome Baby investment, which prioritize those populations via the score that comes out of that assessment. So that's one piece, but there are also some direct relationships within the county, and that DCFS has a memorandum of understanding with the Department of Public Health that runs the NFP program. It's a model that's very well suited to young moms, so they are able to make a direct referral. So there are differences between some of the gaps we need to fill are resource-oriented gaps, but there's also gaps we need to fill in terms of how we identify, how we find families. So for some teen moms, that is the challenge, is how can we make sure we find them? I'd say sometimes they're kind of needles in a haystack, and that building this system to the point where it's universal will really help with that.
The only other point that I'd add is that the highest priority for the NFP program is for pregnant parents in the foster care system. So there is an MOU between DCFS, as Barb mentioned, and DPH that they are the highest priority for receiving that outreach. There are some challenges, as you might expect with foster care teens. They often do not want to release the fact that they're pregnant because of fear of losing the child or fear of other consequences. So DPH has been doing a lot of training around how to strengthen that coordination between DCFS social workers and their public health nurses. And they have some really good data, both in terms of their success of their outreach, as well as the outcomes that are associated with the participants. Overall, their acceptance rate, into the program is not the target rate that you would hope. It ranges between 50 and 60% of teens within the foster care that accept, it's a voluntary program, to participate.
But we're actually the commission is responding to the board motion on the Foster Youth Bill of Rights, and that point is one of the points that we're making that we hope will help with just that problem. That is that your baby is not automatically delivered into foster care. And you're right, teens need to know that.
I love what she's saying. Can I just jump in here? The whole thing when I worked in child welfare was to keep these kids out of the system and the families out of the system with these particular types of unique skills, service development skills that you're going to give to the parents. And what I'm looking for just beyond the kids that are in foster care, but the kids that are actually out there in the community that need this service. And they end up, the foster care system, because they don't have the skills, the intergenerational issues you're talking about, they didn't get the training, their parents didn't get it, and so this generational turning into a foster child needs to be broken. And what happens is if the social worker knows this is available and you can give this service to those families, there's a high 80% or more chance that these children or their babies, because they're teen parents living with their parents, will not end up in the foster care system. When we have 30% of the children that are being born in this county or in high need communities such as Compton and the surrounding cities, we don't have to look far. You've already identified them as a need. We need to do better in how we engage that process in working with DCFS to deflect or defer them to these services so they don't have to come in. And it's voluntary. They still don't have to take it. But I'm going to tell you that rather than being involved with DCFS, they'll jump on it. What I'm excited about, this can go on for 3, 4, 5 years, that they really need. And the issue is that if a social worker gets called again to that house, why did you drop out? What's going on, and why didn't you stay? The bottom line is we want them to engage the service so they can help themselves and their child on a better trajectory in the future. So this is a big issue for me, and then our community, because more of our babies in the inner city are taken into child welfare than anywhere else because of this lack of knowledge and because of this lack of service. I want to be clear, and we have proven, at least when I worked there in Water Ridge, that if you do this, you will not take these children into the system, and the parents are more engaged because they don't want to be a part of that system at all. Just a thought. I do have a question though, but I'll go ahead and yield. I'm just so passionate about this because I see child's lives being devastated, and I was a part of that system to try to stop that dynamic. So go
We
ahead.
want your passion, Mr.
Okay.
Taylor.
Go
So
ahead.
go ahead and ask your question, I think.
Oh, okay. Well, you know, the big thing for mental health is EPSDT funding. And if you can prove the practice works, that you can do it, that's a separate funding than from MHSA, and every mental health provider can provide that service. And you will have that is even a bigger piece of the pie that we're not even talking about. So I'm hoping you will work with DMH to make that practice more acceptable of this select home visitation for all of our communities throughout this county. And that, once you do that, it's on. I mean, literally on, because DMH works with DPSS, and the Public Health Department can access that same pot of money, and we can have this as a sustained practice. One other thing I really would like to see us do more, such as we talked earlier, get the message out of the outcomes. Why is it important for these families to engage this service? What is the trajectory for the betterment of their children and their families? This gets back to the community level. We got to send this message out there and talk to the community and say why this is important so they will want to do this. Not that we're forcing it, but want to have that help and where to get it and how to get it. So I'm just, I'm not hearing that data. I'm just throwing out these two pieces of suggestions.
Commissioner Plate-Deshow had a question? She has a follow-up question.
I'm actually going to grow some of the comments by Commissioner Taylor. So this is a really terrific example of where we look at sustainability and the value add that First 5 LA adds that did not exist in this way. There are sort of 3 buckets that I think about when we think about sustainability in this particular example. And growing on what Commissioner Taylor was saying, the evaluation component, you all have done a really terrific job of giving us that data once a year. So yes, we might get that, but I think about evaluation and the economic evaluation of this, in particular, how much did First 5 LA invest, and how much are we getting for that buck that we invested? And how do we get that evaluation out, specifically as we talk about our long-term sustainability in a way that elected officials will hear it differently, private investors hear it differently, and I don't know if we've gotten that. So yes, the evaluations of outcomes and economic evaluation. The second bucket I think about in terms of sustainability is communications and what story are we going to tell with this. And as we develop that, there's two areas that I'm thinking about. One is the state is paying attention to this. What role would First 5 LA play in that, and how do we elevate that? How do we really tell that? Because it wasn't happening in the way that it is now. And we need to get that story out a little bit more. And then the second part of what story are we going to tell at the end of this, there's community that has come out and has thanked First 5 LA at Best Art events, saying thank you for getting us these spaces that didn't exist here before. There isn't the understanding of how all these funding streams come together, and I don't know if there has to be at the local level, but those individuals that would not have had this without First 5 LA, and it isn't us necessarily funding it, it's us leveraging and being able to pull those out with whatever long-term story we're going to tell. And then the third part that this makes me think about is First 5 LA's connection to the one voice for First 5s generally. And I think about governance here. The reason First 5s don't have a strong voice at the state level is because we don't have one voice. We show up slightly different, and Moira spoke to that a little bit. So with this home visiting, how do we use it as a model in developing that one voice, and how do we develop the model of governance in terms of here's a innovative First 5 county that developed a new program, and then what will they be saying, and then how do we deploy the rest of the one voice? How do we take this example as we work with the Moira and the other counties? And it looks like you all are already thinking about it.
Yeah, can I'll take a little bit of a sort of statewide view, given the couple of questions you had there, and I'll let Barb and Christina and Rena address some of the very local specific pieces. So first of all, I'm incredibly passionate about home visiting because this is how I first got my introduction to First 5, and when I was a nonprofit consultant, and it was all about how do we get multiple people to pay attention to and care about this issue. One of the hard things about home visiting is that it suffers from what people in the finance field call the wrong pocket problem. One person has to pay for the program, but lots of systems benefit. And so that's why this newer approach that our program team is taking locally is so critical, because it's, as Christina calls it, it's the blending and braiding of funding that allows us to achieve sustainability. No one funding source can truly cover the cost of home visiting, because Medicaid will pay for this piece that has to do with a medical outcome, and mental health might pay for this little piece here, and child welfare might pay for this little piece. And so talk about both, to Judy's story earlier, the challenge we have of multiple siloed systems who each care about one component of what home visiting offers families and communities. We at First 5 have to play that role of connecting and making relevant and making the case both economically, but also from just a social justice standpoint, from any number of angles. So that's the work that a lot of our departments are engaged in. At the state level, some of it is as simple as learning from other states who are way farther ahead than California is in taking advantage of funding. Other states maximize their use of TANF dollars to make sure that what we would call CalWORKs families have access to this service. That doesn't get to everyone, but it gets to a portion. Other states like South Carolina are leading on making sure that Medicaid have this as a benefit for families. So we're trying to elevate what other states have already done and trying to help our state leaders understand California is way behind, and we have an opportunity. There's also a lot of misconception around home visiting, because if you say the phrase home visiting, some people think, oh, isn't that what you do with senior citizens when you go and offer some care in the home, or isn't that what Child Protective Services does when they take my children away? And so we've had to do a lot of education at the state level with some child welfare advocate partners about this isn't actually a referral pathway to CPS. This is not, and we've actually had to have our program team pull some data about what is our experience with Welcome Baby and its referral pathway or not referral pathway to child welfare. And frankly, all the data in every national model, whether it's Nurse Family Partnership or Healthy Families America or even Welcome Baby, the data says no, this is actually not a pathway. In fact, it's an opportunity to prevent there from being a pathway. And the moment we started saying that this year, more people, like the Child Welfare Directors Association, are saying, this is actually a quote from a meeting that one of my team members was in, well, if that's the case, why are we arguing this anymore? We should be doing this.
Thank you.
So that's part of what we're trying to do at a state level, is help people understand this is something that you can use to address a number of issues. Education should be investing in this when it comes to pregnant and parenting teens in schools, because there's great data about outcomes, educational outcomes for families. So we're trying to make sure that systems leaders across different buckets see home visiting as a way to address the outcomes they care about. And then locally, frankly, learning from other counties who are already doing this as well. And so the mental health partnership that Rena referenced is an incredible opportunity because a lot of other counties are maximizing their use of prevention and early intervention dollars to pay for home visiting. And LA hasn't been, and now we can be. So that's kind of the bigger federal and statewide perspective that we're trying to push as First Five LA and in partnership with other First Fives. And then I'll let Barb talk a little bit more about local stuff.
Well, I mean, I'll add to that, to give an example of how we've already convened as First Five, and one thing that arises is that many First Five commissions do invest in home visiting in some ways, so we have that as a foundation. But we're going deeper into building that one voice around home visiting. To give one example, there is a program that exists for Medi-Cal clients, the California Perinatal Services Program. It exists in every county in some shape or form. One of our next steps is to get together and say, okay, well, for each First Five, what does that look like in your county? How is that utilized to support either home visiting or shared outcomes that program has with home visiting? And let's look at if there's look for opportunities to adjust or adapt that program to make it more effective and more supportive of home visiting. So we're trying to take that foundation that we have this common interest and investment and become more effective broadly. And that if we do that together, any kind of case we make to the state about how we might implement this program, and there seems to be some interesting opportunity here, is more powerful because we all came together and agreed on it with our local public health county departments. So that's just one example.
Christina, you were going to add something?
I think we've covered it. The only comment that I'd say is the exciting part about home visiting is it seems to be a universally agreed to valuable program, both at the federal level. It's bipartisan across the aisle, well-supported program, and I think as we think about the First Fives throughout California, from the more conservative to the, let's say other along the spectrum, there is universal investments in home visiting, and I think, echoing back to some of the comments Peter started with, one of the challenges that I think we have is that First Fives have historically been doing this on-the-ground work to weave together programs, but haven't elevated themselves as a voice to say, so what does that mean for policy? We left it to the partners in many cases to be the advocates for the systems change work that we were doing at the local level, and I think what you heard from Moira last month, what you've heard from Peter and from Kim, is that First Fives throughout the state are now stepping into that role in a much more intentional way.
Can I offer one final comment on this? Because one of the things I heard in your comments, Carla, was throughout all three is kind of what's our role, First Five LA, in the context of this larger, movement. And I think our team maybe is just too demurring, but I think we have had a big role in this. And it's not necessarily us leading. It's us, walking and moving forward side by side with 57 other counties and with the association. And in particular, I want to commend our policy team for the work they've been doing with the association in better understanding and supporting other First Fives in their local advocacy. A really concrete example is Kern County. First Five LA worked very closely with the association and Kern's First Five Commission that, happens to be represented by whom? Majority Leader Kevin McCarthy. This has not been a high priority for the Majority Leader, but he was an active proponent and supporter of this with, proactive communications between Kevin McCarthy's office and Kern First Five in terms of keeping them apprised and thanking them for their voice and leadership on this. I actually ran into Kevin McCarthy last week when I was in Washington for a day and was able to say, thank you so much for your support of the McVie reauthorization. And I know Kern First Five is so grateful for your leadership. Excellent. It's not about First Five LA, it's about Kern.
Yes.
But First Five LA had a big kind of behind the scenes working with the association and our local First Fives along with California Strategies in terms of saying, where are the opportunities and where are the relationships? We're a big blue county. So I think I'm really proud of the strategy and the execution, and we're beginning to see in partnership with others it really paying off.
Commissioner Tilton?
Most of what I was thinking has been said, but I wanted to just make a couple of points. And first of all, I think after we all go home tonight and kind of try to forget or remember this meeting, the one thing we will remember is Judy's story about the woman and the 6 kids in the van, which kind of goes to my point of trying to become a little more, illustrative of the actual, not only just the impact in the data, but the situations that we have been able to impact, the families, the situation, or just case examples, I don't know what, or maybe a conglomerate, something where people can picture what this is and why it's important, not just in terms of data. The whole home visiting movement in my lifetime started with David Oles back in the mid-90s, proving that home visiting did in fact prevent subsequent child abuse. And yet, where did it go from there? It was really hard to get any kind of support or attention to home visiting other than within the inner circles of people working in child protection. So you made a good point, Peter. People think this is a pathway to CPS. And yet the message really was, this is a pathway out of CPS. This is a way to keep those babies and those young children from entering a system that is not only expensive, but it's also soul crushing sometimes. So, and sometimes worse. So I guess my my comments really are, first of all, I have to be careful when I'm always supporting home visiting from a child protection standpoint to assure that it's a broader perspective, but also not in terms of finding children to bring into the system that are ready to keep them in the system. And secondly, for us as a commission to kind of start hearing about the case, hearing what this did for families that was human. Like when we did home visiting on that woman with the 6 kids, and if we could have. Or maybe we did with another family with 6 kids. I would like to hear that.
Yeah, it goes beyond protecting them and with home visiting, talking about how they won't only be safe, which is obviously very important, but they will be thriving, more importantly, right?
Okay. Commissioner Blakesell, did you want a follow-up? No follow-up? Okay.
Okay.
I'm just going to one thing on communications, and I mean, we literally were just emailing about this earlier today. One of our partner organizations is in the process of writing an op-ed in support of home visiting, and so actually one of the many support services that we're providing for communication shops, Gabe and Marlene, is to actually connect them with some of the families that we work with here in Los Angeles, so that it's not just a theory of change abstract model for people to look at and say, oh, that's home visiting, but to actually connect it with real lived experiences and stories. That's good.
Thank you for the rich conversation. I just want to put in my 2 cents with respect to the evaluation piece, which is, I think, what started some of the conversation on the targeted case management. We are the largest home visiting program in the nation. So people are looking at what it is that we're doing. And I think the evaluation piece becomes extremely important for the advocacy as we move towards trying to not only tell the story on a personal level, but also on a data-informed level to the state legislatures and to the different bureaucracies that we're dealing with. So I'm looking forward to that report on the pilot and the evaluation as we go forward. So I know there's another piece to this, so let's get moving on that one.
So in the interest of time, I think we're going to skip through some of these slides, but I think the conversation really captured the key points ultimately. We do want to bring one thing to your attention. We mentioned that Mental Health Services Act funding earlier in the presentation as a strategy that we're looking, or a funding opportunity that's in front of us, that $50 million. We wanted to put forward that staff will be coming back to the board in March with a request for an approval for First 5 LA to provide up to $100,000 in funding for the Center for Strategic Public-Private Partnerships within the county to support sort of technical assistance around that, sort of operationalizing that funding. So we wanted to use this opportunity to provide that as information, and we'll come back to you next month as an action item. So thank you.
So now I'll hand it over to Kim to talk a little bit about how important it is for us to find other money and the role that we'll play in that work.
So I think a couple of commission meetings back, Supervisor Kuehl, Chairwoman Kuehl, referenced this idea that there is no silver bullet out there, and that the long-term sustainability of public systems to fund young children's programs is going to require lots of funding streams to be brought together. And so as we look at the various funding streams that can be brought to bear for home visiting, that represents one set of stream of, or one stream of funding. But we are constantly on the hunt. We are looking actively to figure out how to grow the pie, as Peter said, to make sure that there are robust funding streams that can support multiple interventions and supports for young children. With that prelude, I'm going to talk about Prop 64 and cannabis revenue, which we have had brief sort of teaser sessions on in the past, but we're going to dive in a little bit more deeply. So just by way of background, Prop 64 passed in 2016, and passed unexpectedly with really high percentage of approval. It passed at 57%. Some of the early polling did not suggest that it was going to be that widely accepted here in California, but in fact actually passed with a healthy margin. When that law, or that constitutional proposition passed, that first legalized use and growing for personal purposes. But as of January 1st of this year, and I'm sure you've heard many of the media cycle stories on this, in addition, what is allowed is the commercial sale and taxation of recreational marijuana usage. In the prior couple of propositions, there was legalized medicinal marijuana use, but now it's recreational. And what's relevant for our purposes in terms of thinking about revenue is in the hunt for alternative revenue, there are not very many new revenue streams that come along. And so in some ways, I think part of the intrigue and level of interest about this new revenue stream is precisely because it is brand new. It is not encumbered. There is no alternative issue area that has first dibs on this, and so in many ways, sort of being early to the punch, I think, is awfully important at the local and municipal level. I'll also just bracket one other conversation, and that's to say, for purposes of today, we're talking about revenue. There are also robust conversations going on both at the state level and also conversations that we've been a part of at the city level to talk about public health impacts, and in particular, vulnerable populations, as you were alluding to earlier, for pregnant and parenting teens in particular. We know from the experience of Colorado that that is a very vulnerable and susceptible to continued marijuana usage while pregnant, and we know that the public health impacts for in utero are significant. And so that is one aspect of what funding can be used for, but the broader revenue conversation is inclusive but not limited to a public health conversation. So at the state level, there are ongoing efforts, and interestingly, the state level conversation is going at a slower clip than the local. And that's because there are a set of earmarks that essentially provide funding for environmental impacts, for CHP, for research that are actually spelled out in the actual ballot measure. And so those first call efforts are already mandated in the actual ballot language. What that means is that as the money begins to materialize in terms of revenue, the latter order sort of discretionary purposes will be coming later. And so in terms of the state versus local interaction, locals are actually going first and are more likely to have discretionary authority over cannabis revenues more immediately. So the example that I want to just walk through is that of the city of Los Angeles. Although it is not the first, I understand it's the city of West Hollywood that issued the first licenses in the county of Los Angeles. But the city of Los Angeles obviously bears particular importance just given its size as a city. In December of last year, the City Council approved a social equity program for its licensing program. And this is essentially their broader regulatory regime for how the recreational sale of cannabis would work. Although there's a whole lot of intrigue and detail in that, what's relevant is that in the initial chief legislative analyst report that came to the City Council, there was a unexpected proposal that was made to create a community reinvestment fund. So not just to deal with how to do licensing for businesses, but actually how to reinvest funds in neighborhoods that were historically most impacted by prior cannabis regulations, so prior incidents of arrests as well as criminalization and incarceration. As the legislative hearings continued in the fall of last year, they came up against a couple of legal snags, and so decided to bifurcate those two proceedings. So in December of last year, they approved the licensing, which allows them to begin to issue licenses and collect revenue. What they have left, and what is a topic of conversation that we're involved in right now with the City of Los Angeles, is whether the City of LA will revisit this 20% set-aside proposal to actually reinvest in the neighborhoods that bore the brunt of cannabis regulation. Among the proposed uses for that revenue, the chief legislative analyst offered what was essentially a laundry list of potential purposes. Everything from sewage upgrades, sidewalk repair, some health, housing, and human services related investments, but appropriately, one of the investment areas that they proposed was youth development. And so early in December, we worked with Councilmember Weezar's office as well as Councilmember Marquise Harris Dawson and City Council President Herb Wesson to put forward a motion to redefine and prioritize youth development to be encompassing of 0 to 18. Youth development most often is defined as older kid facing, and it provided a platform, A, to talk about pregnant and parenting teams, which are oftentimes sort of left out of the conversation around youth development, but also to say, hey, 0 to 5-year-olds are kids too, and should be defined in the ordinance as such. So we are in the early stages. The fire that I think the City Council was experiencing and the urgency around the January 1st, 2018 date has dissipated. And so our work really is about keeping on the pressure and continuing to push for an allocation for youth and child development in upcoming budgets. To also reference now Commissioner Fielding, is that the original author of this Agent of Scale and Sustainability? Kaufman. Okay, sorry. As the state budget is 180 billion, the county budget is 30 billion. The City of Los Angeles budget is 9 billion, and the expected revenues from cannabis were clocked at about 50 million, which, if you get a 20% set aside, that's 10 million, which is not going to revolutionize the lives of 650,000 young children across the county. Part of what we expect will happen is that the expected revenue growth numbers will in fact go north of that 50 million estimate. The state of Colorado at year 4 of implementation has about $260 million in revenue and is considered a mature recreational cannabis market. Even if we got 20% of that, obviously that only puts us at about 52 million for 0 to 18-year-olds for the City of Los Angeles. So all that's to say, and I'm sorry for the quick math, but all of that is to say that this is additive money, and we should absolutely, for any new revenue stream, be looking to ensure that the public debate is inclusive of 0 to 5-year-olds, but it's not a cure-all. This is not our cure-all or silver bullet, one-shot and done new revenue source, and it sets up the expectation that this is part of the debate, but it's not going to completely end the debate there. I'll also mention that in a couple of other counties, the First Fives are doing really interesting, innovative work with developers. In YOLO in particular, they are looking at community benefit agreements to actually prioritize either mental health or ECE or home visiting services. And this is, I'm going to just acknowledge, a brave new world of looking to insert ourselves into community benefit agreements with developers that we have not pursued before. But if our mantra is essentially for any new revenue that comes online, little children should be considered, then we're going to have to push into new areas where we have not been in the past. And so that's part of the excitement ahead. I'll also mention that in the Choose Children campaign, which this commission has approved an investment over 2 years, this is the gubernatorial candidate engagement series on which we are partnering with the Silicon Valley Community Foundation in an effort to educate gubernatorial candidates. As of the completion of their initial forum, the 3 Democratic frontrunners, Gavin Newsom, Antonio Villaraigosa, and John Chung, all promised on record that they would make universal preschool a priority for their new gubernatorial terms, and that they would also support increased investments in the state budget for early childhood. Gavin Newsom also spoke more broadly around prenatal supports and home visiting, and so there are opportunities ahead, but also there's real work to hold them to their words and make honest men and women out of them. And that's good work that is appropriate for us to be doing. In terms of early childhood initiatives more broadly, Funding the Next Generation is a initiative that is funded actually by our friends and partners down the street, the California Endowment. And that essentially is an effort to look at county-wide ballot measures around children's programming. Again, looking at a broader swath of ages than just 0 to 5, but certainly being inclusive of 0 to 5. And they have seen success already many moons ago in the city of San Francisco, which has a children and youth ordinance that taxes growth in property values, but has given rise to a steady funding stream that supports both universal preschool, math, PE, arts, and music programs for the K-12 systems, as well as supportive housing for older age homeless youth. Coming to the Northern Cal ballots as well, Alameda County and Oakland also have measures coming forward to increase revenues for early childhood programs. And those are really interesting sort of stories of collaboration with labor and SEIU in particular to fund things that we cannot fund as a public agency, but organizations that are C6 membership organizations are fully within their rights to do. Sorry, I'm gonna just skip quickly, I'm running out of time. In terms of takeaways, I'll touch on these, but I think we have actually described several of them already. The first is that in all of these revenue efforts, we are looking to grow the pie for children and families. If we can be useful and helpful in administering funds or facilitating the administration of those funds, we are absolutely happy to do that. But we are not looking, it is not our position that money needs to flow through the first fives in order for children to benefit. And in some respects, that gives us a halo effect, which I think makes us an easier partner. I think, and I don't want to characterize this in any ways that suggest a value judgment. Not all of the first fives are of this mind, and that's okay because they have different existential sort of dilemmas. There are some first fives, less fortunate than our own, that are actually considering shuttering. And so they have a different space to occupy in this debate, but we have the great fortune of being able to say, so long as kids benefit, that's where our advocacy is focused. I think I already talked about cannabis as being one of many strands that we're looking at, but not the answer. And then more broadly, I'll just say that in terms of our work with municipalities, what we're talking about right now is actually new funding streams, but there's also a host of other municipal policies that we could look to grow support among cities for sustainability. I always look winsomely at the city of Santa Monica and think about the degree to which Santa Monica champions early childhood explicitly within their city government. And there are burgeoning efforts in Pasadena, in Long Beach, that are actually about not just marketing the cities as family-friendly cities, but actually growing what it looks like for a city to actively involve themselves in the support of families and young children. Lastly, I think in terms of next steps, there's an ongoing body of work which is about champion cultivation. We are crystal clear on the fact that we cannot do this work alone, that we need electeds, we need the business sector, we need higher ed, we need every unlikely ally we can get in order to actually make a big lift for young kids. And so thinking about what our coalition strategy is and also how to best work with and leverage the gifts of each of those types of coalition players is part of the strategy of making sure that if we propose that a new revenue stream be dedicated to young children, that we are not out there alone making that request. And I think we've covered a lot of this, so maybe I will just end there. Because I think we have 5 minutes and we're supposed to end, so I just want to make sure there's some time for questions. Sorry.
Thank you, Kim. Questions from commissioners? Comments?
As we go through this, looking at it again from the community standpoint, especially the inner city community, a lot of our families get services from FQHCs. And we need to go at the federal level and advocate for this, that it be qualified for FQHCs to provide Welcome Baby, provide Help Me Grow, provide the select home visitation if needed to help these families, because that's another funding stream and another service provider that's huge in these needed communities throughout our county. If the FQHCs are doing it, then you're filling in a huge gap that nobody's talking about. Just a thought.
And do you want to talk about Access DC at all in terms of federal?
Well, sure. Not just Access DC, but upcoming in just a few weeks, there will be a delegation of First 5 LA staff who are joining the LA Chamber in their annual trip to Washington. We are critical partners in elevating the early childhood perspective in a lot of those forums. One very critical issue that we're actively engaging on federally is immigration, because it is an important issue that is preventing families from accessing services that we care about. But also, we're building a lot of partnerships locally that have advocacy payoffs at the state and federal level. And one, actually, to your point, is the Clinics Association here in LA, who share a lot of common interests. A number of their members are providing some of these services in our communities. And so we're actually excited because they said, great, we can do meetings together in DC. And so we're just trying to this point of relationship development, align where other members can, where we can, there are co-benefits to our partnership.
Commissioner Smith?
I just had a comment. The continuing discussion, I think, make me think about your earlier comments, Kim, about the two kind of ways to think about this in terms of, you know, the general mission of improving things for children under 5, as well as the role and capacities of First 5. And I have to say, I think the communication of what it is and what we do and what needs to happen is something that we just have to stress more, because I'll tell you, I mean, I'm a fairly new commissioner, and when I tell people I know who are not in the child welfare community that I am, they never know what First 5 LA is. And there's something wrong there, you know. So I think that could affect philanthropy, because I've been very involved in philanthropy to foster youth serving kinds of organizations, but I never hear about philanthropy related to the First 5. So I just think there needs to be so much more communication about what we're doing and what we feel everybody needs to do.
Commissioner Martinez?
I agree, echo, as a new commissioner, same thing. I'm constantly explaining to people what they do, and I think the first response is, oh, so it's the poor children that you're, and I'm like, no, it's just not poor children that we're helping, it's everybody. So that's just one thing. And then Peter, you mentioned that you got a sense that some of maybe the big healthcare industries and the clinics, the kind of big gun, big insurance, that they don't really get what we do. So who would be the best messenger for our overall message and strategy to communicate to the Aetnas and the Blue Crosses of the world what we're doing, why this is so important? I mean, I get LA Chamber, and are they involved in that too, or?
So there are a couple layers on that. So one is, and I want to really stress one of the points on sort of the key takeaway slide, which is every staff member at First 5 is going to be carrying this message more and more moving forward. When I first started, there was a lot of work that was sort of, all of this is policy, and so therefore it's the policy department that does it. And we're really shifting this to say we are all ambassadors of who we are and of changing systems and policies no matter what we do. So I think if we could, you'd have 14 different departments up here all saying how they're carrying this message. So in the advocacy context, first part of it has been in 2017 we were spending a lot of time just mapping. Who are the key, in partnership with our state advocates, who are some of the key influencers to different decision makers in Sacramento? Who are the associations and partners and advocacy organizations we need to have relationships with? Because we started a couple years ago with build the strength within the early childhood known advocates and the critical organizations there, and then it was, okay, we have some good relationships there finally, because we didn't have them as much before. Now let's expand out to other partners who are critical advocates. But I also think part of this is then locally, who are the key systems leaders and drivers and providers that maybe we've had uneven relationships in the past and being a lot more intentional. So when I was talking about the clinics, it wasn't just the policy team who was having a conversation with them in the context of us doing advocacy with each other that's co-beneficial, but it was also Tara, our director of health systems, who was there talking about the on-the-ground work and the opportunity for partnership there. So Christina or Barb, you want to say a little bit more on the program's perspective?
Trying to coordinate here. So I think you're absolutely right to bring up this issue of health plans. Particularly, I'll just give the example that within the home visiting board motions, we recognize that there are, and Barb referenced earlier, CPSP, which is a program that's available for all Medi-Cal beneficiaries about supportive services, including 1 or 2 home visits. So we have just very recently, within the last week, held meetings with leadership. We've had a long-standing relationship with LA Care as the one of the Medi-Cal managed care organizations in LA County, but recently having conversations with both Health Plan and HealthNet, and Care First, to understand what is their both prenatal and maternal child health. What are their prenatal and maternal child health investments and benefits, and how can we coordinate and maximize? So some of this is education to beneficiaries of what they're eligible to receive, and some of it is also recognizing that how can we better coordinate these services. So we've had tremendous learning just this week about services that are available in the Antelope Valley and a pilot that's going on with one of the health plans, and how can we coordinate our services that are direct, we're both working in the same community on the same strategy with expansion of home visiting.
Sorry, one more comment to get your point around who can be trusted messengers. I think to Kim's point earlier on the home visiting example and federal advocacy with First Five Kern County, because people don't want to hear from LA, part of it is knowing when can we be our own champions and when do we need others to speak for us. And a really good example of this is we've been critical drivers in Assembly Bill 11, which, as you may recall, is the bill around early identification and intervention. But when we were working with Assemblymember McCarty's office around setting up an initial hearing for other members of the legislature, First Five wasn't anywhere on it, but what we did put forward was Dr. Patel. Dr. Patel being one of the key leaders here locally with our First Connections work. And actually, by having Dr. Patel there, it was great. We got other legislators to sign on in support of this bill because Dr. Patel provides services in their community. So Assemblymember Wendy Carrillo said, well, because you provide services in Boyle Heights, I want to sign on to this bill. So we weren't the messenger there, but we were kind of behind the scenes connecting the dots between the trusted messenger in the community and the decision makers. So we need to do a lot more of that as well.
Yes.
Okay. Well, Commissioner Fleites.
So I got the image of Kim Patello Bronson being on the hunt for revenue. It's wonderful. It is. And there's a sixth sense, I think, that we're developing here for that. In the cannabis conversations, thank you to First Five LA for bringing together a coalition in LA around this. There's 2 things that I think are worthy of mentioning and trying to figure out what we do about this. And one is the families that really were most impacted by marijuana arrests or just abuse of marijuana. Those families are now really pushing back against having facilities opened up near them. So we really have to think about, it's sort of 2 different issues, right? There's the facilities being opened up. Yes, that's a zoning issue, and families, communities need to have that conversation of what they want in their communities. But once it's open, it's a different conversation, and I don't think our communities fully understand that yet. So I'd love to hear what sort of messaging is being developed or how we're handling that issue so that there's advice, because this isn't just an LA City thing. This will be happening in other jurisdictions. So how do we deal with that sort of 2-prong? And then the marijuana revenue conversation is really going to be a 2018, 2019 conversation for jurisdictions. So how do we take what First Five LA is doing and have a campaign toolkit that other people can benefit from, because we're not going to be able to do this for all jurisdictions, but other people really want to get engaged in this, and the lessons learned here would be really helpful for other jurisdictions as we think about raising revenue for this specific issue.
And for staff respond, if I can just add to what Commissioner Howard said, I agree. One of the things that I personally have experienced is having to close early learning centers because of the facilities that have been open, parents having to pass long lines, a great deal of smoke to get their kids into the learning facility. Early learning facilities are not considered school zones. And how can we be influential, even if it's just a bit of dollars that goes into helping to shape the ordinances about any early learning facility has to be a school zone, and you can't set up in that environment.
That's a great addition, and I think the land use and zoning conversations are a great place for us to think about plugging in through our community relations team, actually. The actual tracks that they go through on city council for land use and planning decisions is a different set of decision makers than the revenue folks on the rules committee for city council. But part of the great gift of having a community relations team now is that we actually have new capacity that we have not had in the past to particular issues. Excellent flag. I love the idea of the toolkit. We have not actually done that in the past, and it's a great idea to think about how to enable other CDOs and other sort of neighborhood organizations that might want to actually be involved in this, and that's fantastic. The issue around families not wanting marijuana dispensaries in their neighborhood, and also sort of what switch needs to happen once a dispensary is open. What's really interesting is we've had a number of city council meetings already where there's an immediate, I think, and very understandable sort of push that people want to make sure that these dispensaries are not selling products to underage children, not just 0 to 5-year-olds, obviously most hideously to think of, but are just not selling to underage junior high school students or high school students. And so there are a host of enforcement issues that I think we absolutely have something to say about protecting young children, but also protecting teens who are likely to be exposing their young children to secondhand smoke, to the potential of accidental ingestion of edibles that look like gummy bears. There's a host of issues that I think so there is an effort at the state level already to start doing some of the public health messaging. There's a little bit of candidly a game of chicken or horse in that, where we're hearing from city folks that the city council people that they're waiting for public health messaging from the state, and the state is saying, well, we're not going to get it together, and we're waiting for the cities. So,
Julie, the switch I'm talking about is the zoning is already there to allow it, so it already exists. It's just the revenue that's going to come out of it, and families not seeing this as the zoning part of it, but it is the switch of it's already here, and how that happens for families. So it's just part of the messaging as we move this forward in some of the other cities and jurisdictions.
Well, thank you to our presenters. This was a very, very instructive presentation, as well as a rich conversation, and I'm sure we're going to be hearing more as we go forward. So thank you for all your work. We will be taking a 10-minute break.
Right.
Hit my nose at some point.
I just wanted to make sure we just try to do the right thing.
Yeah. You did great. Yeah, I mean, I did the math. No, well, I did the math, and I think we're 7 minutes in. So I think technically we're 3:15. Because they were supposed to start. Yeah. Well, no, because I think part of it was